Good morning, everyone. Happy Monday to you. And thank you again for joining us in the conversation about the role of social workers in transforming mental health and in the context of social work power and what that social work power looks like, feels like, is experienced for each one of us. We have been in this conversation for several weeks now. I think probably a couple of months already. We've been doing these Monday and Wednesday posts, and then also writing articles. And we have our social work power certificate course that runs on Fridays from 3:30 to 5. And you could attend one, you could attend all of them. That's completely up to you. And we also have a social work code of ethics course that runs on Mondays from 1 to 2. So we have a lot going on that is looking at what it is to be a social worker from multiple different lenses. What does it mean to be a part of this transformation? And again, as we've continued to say, there's these two sort of things operating at the same time that are informing each other in the process. And the one is, what does the transformation of mental health look like? And as we've been talking about, we see that the more we talk about mental health as something that is distinct and apart from health, the more challenges we will have in this transformation. So I'm going to start changing my language around it to be about the transformation of health. And what that looks like, and how we can create that. So that being one of the pathways, but the other pathway that really has a significant hold on us has been who we are as social workers, this means for us, our identity, what is our privilege around it, what is our role, what is our responsibility of this transformation of health in the context of who it is that we are and why it is that we chose this profession to begin with. And so it's been this really, really dynamic series of conversations that I've been having with multiple different social workers across the United States, as well as within the different groups that we have that are focusing on these topics. And it has been truly fulfilling to have these kinds of conversations with people and to be able to really be a part of the listening to what is coming up. What are some of the barriers? What are some of the things that we want to do but don't feel empowered to do? And that leads us to some of the conversation that we're having today. In this article that we've been using to guide some of this conversation, is this, the role of social workers in the transformation of health. Are these different elements that we have been talking about, and we talked about last time, leading with empowerment and what it means to be able to do that. And then with that also, what we're talking about today is this creating of the ripple effect. Modeling empowerment offers fellow social workers the opportunity to know their own empowerment is within reach and is essential to creating a far-reaching impact. It's the whole idea of you can't give what you don't have, as well as the idea that we all have, different ways in which empowerment can show up for us. And just because it doesn't necessarily show up in all the different domains of our lives doesn't mean it's not there. It may be there in one area of our life, and that area of our lives, when we identify it, can cultivate it so that it could span to the other areas of our lives. I know that advocating for my son, for example, is something that I'm able to do, as a mother, but also as a social worker. And so it's hard sometimes to pull these two things apart, but I know how to advocate for him. And I know how to advocate in my work when I work with clients, when I used to do case management work. Now, translating that to then advocating for myself becomes a different kind of conversation. Now, it doesn't mean that I don't know that I have the capacity to advocate for myself, and it doesn't mean that I don't do it when I need to, but it does mean that for me, and this is the reflection opportunity, that for me, the advocating for myself gets sort of knocked down a few notches to the advocating for other people and other important issues and topics. I also know that this is something that I continue to work on, because there are thoughts there that make me feel like that I don't need that, or I don't, or that's not important enough, or I'm not important enough, or whatever that conversation sounds like. It certainly doesn't sound empowering. And so there's an opportunity for me to be able to reflect on what are the thoughts that I'm having that tell me that. And then being able to challenge those thoughts and then shift them to, to the thoughts about my value and my worth in the world, and how I can model for people and hopefully create that ripple effect so that other people can see the power and the empowerment within them and be able to continue that process forward. So that's it for me today. Thank you again, so very much for being in this conversation with me. I look forward to hearing what you have to say about what it means for you in the context of empowerment, and in the context of being able to be a model for other people in empowerment. So put your comments in the bottom. We look forward to hearing from you, and have a wonderful, wonderful rest of your day.